Good afternoon. Thank you all for joining the support group today. My name is Helen Thacker. I'm here with Paige Herringer and Morgan Boyster, and we are occupational therapy students here at Eastern Kentucky University. Today, what we're going to be focusing on is rest, sleep, and stress management during this support time together, and just be going over some basic strategies, some adaptive techniques, all of those things, so that way you can incorporate that into your daily routines to help promote better rest and sleep if you've been having some struggles with that since your amputation injury. So, OT's role essentially in rest and sleep stress management is what I just said. We just want to address any sort of physical, emotional, and environmental barriers and just promote routines and strategies to improve sleep quality overall. So, has anyone been having any sort of challenges with their sleep and their rest since having their amputation?
I've been having some pain and discomfort while sleeping. That's how it's broken my routines.
Yes, I completely understand. So here's just a list of some things, challenges post-amputation that are very common, but can definitely promote some barriers during your daily activities. So any sort of decreased mobility, disrupted routines, all of those things are really going to negatively affect your sleep and your rest, which in return is going to negatively affect your performance in daily activities. So the purpose of today, what we hope that you go home with is just a better grasp on some simple, effective stress relief and sleep improving techniques. So that way when you get home, you can get a good night's rest and you can feel like you're ready for the next day, okay? So we're gonna go ahead and we're gonna get started with our first intervention today. So we're gonna be talking about sleep positioning strategies, but also things to incorporate into your routine prior to whenever you get in bed at night. So, how do you normally sleep at night? What do you normally do before you go to bed at night?
I usually sleep on my back.
You normally sleep on your back. Well, that's the best position. We're going to be talking about that a little bit later, but I'm going to go ahead and I'm going to talk about this first. So, residual limb massage. So, this can reduce pain before you go to bed at night. It can promote some circulation and relaxation, and it can decrease muscle tension and stress. So, what we have discovered over lots of research is that normally our bodies are super duper tired from the day before, but our muscles are still really working and they may be super stressed and may just have a lot of tension. So removing some of that prior to whenever you go to bed at night is going to be really important. And so pairing a relaxation technique such as manual muscle massage of your residual limb is going to be really important before you get into bed and have proper sleep positioning. So here's another demonstration of sleep position, and we are going to do that in the back today, but just a quick overview. Sleeping on your back is the best position, so that is really great if you do that already. There's going to be a quick checklist of things to avoid, but we're going to go ahead and we're going to demonstrate back here on the mat. Okay, so before you go to bed at night, some things that I would really recommend you do is go ahead and set up your pillow before you lay down, maybe grab your blanket, go ahead and get that set up. Turn your fan on, anything like that, just to promote a relaxing environment before you go to sleep at night, okay? So what we want to demonstrate today, have you ever done a residual limb massage? Is that something you normally do whenever you have some pain? Okay, well, so this is the area here. You just really want to massage gently over this area for about 5 to 7 minutes before you go to bed. Do you remember what this was used for, why it's important to do this? No. Well, it promotes muscle relaxation. It improves some circulation in there just to get your blood flowing before we lay down at night. So can you go ahead and demonstrate that for me? You just take both hands and just massage right around your residual limb, okay? Have you been experiencing any pain in the limb?
Yeah.
Yeah, so again, this can really help reduce some of that pain as well. And it's not just paired with sleep quality, but you can do this anytime throughout the day, about 5 to 7 minutes just in this circular motion. Yeah. That feel okay?
Yeah.
Okay, perfect. So let's go ahead and let's lay back in the bed. So go ahead and lay down for me. Okay. Do you remember what the best position is for sleeping?
On your back.
On your back, exactly. So some things that we really want to make sure we check and things to avoid is you're doing really great. Your body's in alignment and that's perfect. We're going to really avoid putting any sort of pillow up underneath your residual limb just because we really want to keep our hip in alignment. That can cause some contractures in there and we just really want to avoid that. We want to make sure your limb is not hanging off the side of the bed because, again, we want proper circulation in there, and we just want to make sure you're as comfortable as possible, okay? Does that feel okay? Do you feel like you're in a good position?
Yeah.
All right. So you can go ahead and raise back up for me. And then we're going to go on back over to the table, and we're going to talk about a few more things, and I'm going to give you a handout so you can take it home.
Okay.
Okay, so like I mentioned, just preparing before you go to bed is going to be really important. just to improve some sleep quality. So engaging in relaxing techniques such as the massage that we practice together, and just making sure that you are laying in bed on your back. I have a handout here. It talks about sleep positioning. It talks about some things to avoid while you're in bed. And it has a quick checklist here for you. So whenever you go home, you can make sure, is my limbs supported? Is it not tucked up underneath me? Is it on the bed? Do I feel comfortable? All of those things. And if you have any questions, my contact information is right there. Do you have any questions for me right now? Okay, perfect.
So, my name is Morgan, just to say that again. And I'm going to go over now just the aspect of stress post-amputation. I know that this looks different for every single client who's had an amputation surgery. So amputation is not just a physical loss, but it can be an emotional, or it can carry an emotional and psychological consequence. And so research shows that those who have undergone limb amputation, they're at higher risk to experience stress-related disorders like anxiety, depression, and even PTSD in some cases. And this, we definitely see this when somebody has had an amputation that it was like a really traumatic event. It could have been like a medical emergency or an accident or something like that. And so some of you all may have had time to prepare for your amputation. Not that you still won't deal with stress, but you kind of had time to talk with your surgeon, speak with an OT, and kind of prepare for that, while others may have not. And so no matter the cause of your amputation, the recovery phase can be really demanding. And so stress and anxiety often interfere, that you all experience from this, that can often interfere with sleep and rest. And then that also interferes with your ability to do your day-to-day lives. And so I'm going to be showing you all some deep breathing exercises. We're going to be focusing on just some relaxation techniques. And so I know you all think, oh, deep breathing, that's silly, it's simple, but research shows that it actually works. So just some benefits of deep breathing. What it does is when you deep breathe, it activates the parasympathetic nervous system, which actually lowers your heart rate, it decreases your blood pressure, it reduces your stress hormone that we know is cortisol, and it even enhances brain function, improves oxygen flow, it'll boost focus, clarity, and even rest. And so it also can promote mindfulness as well. And so we see this, not only does deep breathing work for just the general population, you know, everybody deals with stress from time to time, but research has actually shown that specifically with amputees, that it can actually reduce stress within just 2 weeks of doing these exercises. And so there are several different types of breathing exercises. A lot of times you can find a lot of things online. So quickly, we're just going to look over diaphragmatic breathing. And so your diaphragm is underneath your lungs. And so what happens when you take a deep breath in, your diaphragm, if you aren't familiar with what it does, it actually comes down, and that allows for your lungs to expand. And so this just helps lower your heart rate and just get more oxygen in. So if you want to do it with me real quick, you can get comfortable and you can do this here or even at home, sitting or lying down. So you're just going to get in a relaxed position. Make sure your shoulders are at ease. And you're going to place one hand on your chest and the other hand on your abdomen, just below your ribs. You're going to inhale through your nose, and you're going to breathe in slowly and deeply. And when you do, you're going to feel your belly rise, and your chest should be staying pretty still. And then you're going to exhale through your mouth. Gently tighten your abdominal muscles and let your body fall as you breathe out. And so it's that simple. You're going to do that for about 5 to 10 minutes, and you can start doing that just about twice a day. And so I do have a handout here, and it'll show how you can do it laying down or sitting, whatever you prefer.
So now we're going to be talking about pain pain specifically and how that can add to stress and disturb your sleep. I'm sure a lot of you are experiencing increased levels of stress and some disturbances in your sleep based on the pain, and we're going to kind of break down why that happens. So after our amputation, we can experience multiple different types of pain, but one of the most common types of pain is called phantom limb pain. It's basically when you feel a painful sensation on the amputated limb that does not exist anymore. So this can present as stabbing, burning, electrical shocks, sharp, dull, cramping, shooting, and throbbing pain. It can present in many different ways, and it's all unique to every person. But the pain happens because there is a sudden change from your brain to your body. So your brain is sending the signals to the part of the body that it is not able to receive it anymore, so that causes painful sensations. There's just a miscommunication between the two, so it can be a little bit confusing for your brain, which results in pain. And then another type of pain that a lot of people feel in the residual limb can be hypersensitivity. So basically that's just when the amputation has very extreme pain when some stimuli isn't exactly painful. So you could brush it and it could be sharp, very sensitive pain when typically we wouldn't feel that. So we have the phantom limb pain and the hypersensitivity, and those can affect your daily routine and quality of life because pain can cause stress. It can be stressful because you don't know why it's happening. It can be stressful because it prevents you from doing other things in your routine. And there's also a lot of emotional factors with that. It can be frustrating, you can be angry about it, or maybe even confused. So pain can also cause sleep disturbances because when you're sleeping, it's very hard to fall asleep when you're in pain. And also a lot of the pain typically happens to be the worst at night. So we're going to talk about some ways to decrease your pain to help with your rest and sleep. So today we're going to be looking at desensitization therapy, and it is an activity based on sensory re-education that helps reduce that hypersensitivity in your limb. It is involved, we use different types of stimuli, so it could be different textures, different temperatures, and different pressures. We're going to apply those across the limb with the goal of desensitizing, and this can help normalize the feelings in the nervous system and help bridge that gap between the amputation and the brain. And now we're going to be looking at doing some desensitization back on the day. Okay, so we're going to get started with our desensitization. You can do this in any environment. I'm going to send you home with a handout later, but you can do this at your house. You can do this while you're seated. We just want to make sure we're in a comfortable position with our limb being supported. So I have our box here of different desensitization textures. So we have a cotton ball, we have a soft cloth, and then we have some rougher textures as we build up, like sandpaper and a rough brush. Today, since it is our first session, I think we're going to start with a cotton ball, but if you want to move up, you can always let me know. So I'm going to have you take this cotton ball, and I want you to rub it on your left leg. And just, how does that feel? It's soft. Is it painful?
No pain.
No. And I just want you to really remember that sensation and look at the cotton ball being applied to your leg and remember that softness and no pain. Okay. So now that we did it on our left leg, we are going to lightly do it on our amputated leg. You can do it around the scar area, or you can start higher up, which typically has less pain for people, and you can work your way down if that's more comfortable for you. Don't push yourself past any uncomfortable limits, but we can start up at the top and we can see how that feels, and you can work your way down to the amputation. How is that feeling?
I can definitely notice how it gets more painful towards the scar.
Yeah. Does it feel the same?
It is not. It's more painful. It's like a burning sensation.
Okay. I want you to really remember and sit with that thought of how it felt on your left leg. Remember the softness and the non-painfulness. How does that help with the right leg?
It helps reduce the pain.
Okay. So you can go ahead and stop. So how did that feel? How was that experience for you with the comparison?
It was definitely useful.
Okay. So we can continue to work on that. It's going to be a little, you're going to work on more textures and longer periods of time. We just did a little example here today. But I do want you to remember that it is okay if it's uncomfortable in the beginning. This is a healing process and it will take some time, but hopefully we can get that leg less sensitive for you and you can have less So I have a handout here for you. It's going to look at just a reminder of the purpose of desensitization. It has what you can grab at home, so we can use a towel, we can use our fingers, and then some other materials that we can use that you should be able to find at your house. And then this is our routine here. It's what we did today was a modified version. This is a little bit of a longer routine, but it tells you how long to do it with different textures, but we're going to use those same principles. I'm going to take this handout. Hopefully we can apply those at home to help with your sensitivity.
So now that we've already mentioned sleeping positions, relaxation techniques, desensitization, but we also have here just overall tips for sleeping and relaxation. So I'm just gonna go through these quickly, and then if you all have more questions later on, we have a handout with this on it that you can take home with you. But number one is a consistent sleep schedule. Number two is get morning sunlight, and we even have on the handout why it works. And then three is limited screen time before bed. We also have why it works and a tip for that as well. We've already talked about relaxation techniques, and then just create a comfortable sleep environment. So the temperature, keeping it cool, the lighting, and you may even want to use like blackout curtains or a white noise machine.
So I know today we primarily focused on lower limb amputations. Mr. Arby was our example. Thank you for participating today. But I just wanted to reiterate that all of the adaptive techniques and strategies that we talked about and we demonstrated today can be used for a variety of conditions regarding amputations. So even if you have suffered an upper limb amputation, a lower limb amputation, bilateral, anything, all of these routines will help you get better rest and sleep. And so incorporating these into your daily activities, even though your life and your situation may not look exactly like Miss Darby's, all of these are going to be very beneficial for you to use at home.
So just to wrap up today, just reviewing what we did, we looked at some proper positions for sleep, we looked at some deep breathing techniques to help with stress, we looked at some desensitization techniques to help with decreased pain, and then we also looked at just some environment modifications and how to have a proper sleep routine. So looking at everything we did today, would anyone like to share anything that they think they're going to use at home or that they particularly like?
I think I'll definitely use the sleep position and the desensitization for like rest before I go to bed, since I'm gonna have some issues with that.
Perfect. That's our goal here, that you all can take these interventions and take them home with you, use them, and apply them to your routines. Does anyone have any particular feelings about what we did today, or any emotions with that they would like to share?
I felt really good about all the exercises. I think it'll really help calm like my stress and anxiety following that amputation, and it'll be something that I can really incorporate in my routine.
Good. And we just want to remind you all that this is a process, so it will take some time, but hopefully we can get you all into some good routines, and that can help you with your journey. So we have your handouts for you to take home, so you can utilize these practices on your own. We just wanted to say thank you for working with us, and if no one has any questions, we will see you next time.